All right, we're going to go ahead and get started. Welcome to this week's session. I'm Kate Tingley, the Director of Marketing here at Infinix, and I'm pleased this week to be joined by our Director of Client Success, Lora Pada. Thanks, Laura, for joining us.
Hello, everyone.
And this week, Laura's going to bring her expertise, and we're going to chat about the No Surprises Act, which is definitely impacting providers and how AI and technology can help. So, all right, let's jump right in. Laura, what is the No Surprises Act? I think that's probably important to define that first.
Yes, that's a great way to start. So basically, the No Surprise Billing Act was effective this year, on January 1st of this year, and basically makes it illegal for providers to prevent patients with bills exceeding the in-network cost-sharing process for where the patient didn't actually know or knowingly choose to use a service from a provider outside of their network. So it gets a little complicated, but if you think about it in terms of you're getting a surgery done, and then all of a sudden they have to add an anesthesia, but the physician is out of network, the patient won't be penalized for them being out of network, and they will be billed as an in-network. So that's probably the primary reason, is just creating a way to protect the patients from, obviously getting these unwanted bills after the procedure's been taken place. People with Medicare and Medicaid, they are already protected, so they are not at risk for the surprise billing. But in simple terms, if a patient requires a service for any type of external service and there's no other alternatives, the out-of-network provider should be treated as if they were in-network when it comes to billing the patient. So it's basically banned for emergency and non-emergency services. It removes the patient from being stuck in the middle between payment disputes between providers and the payers. It helps ensure price transparency requirement protections for the uninsured or the self-pay patients. So estimates are required for all uninsured and self-pay patients. And a lot of these times, a lot of the healthcare systems and provider physician groups and hospitals already have some type of payment plans that they can put in place. A lot of them also provide discounts if they're self-pay. So it's just basically making sure that they're protected. It provides a safe and easy way for patients to dispute their bills if this should come up. And then it also, most importantly, it protects the patients from ensuring that their medical needs are met without having to worry about unexpected additional costs. So in a nutshell, that's pretty much what it covers.
Thanks, that was a great explanation. How are we seeing this impact providers, and are there specialties in particular? I know you mentioned anesthesia. Are there other specialties where we're seeing this impact more than others?
Yeah, it definitely impacts pretty much all providers. It applies to many different areas within the healthcare system. I don't have the exact list, but it does include many specialties, all specialties, but it's not limited to, again, the all out-of-network emergency facility professional services, post-stabilization care for out-of-network facilities. So basically, until a patient can drive themselves to a different facility, they won't be impacted. Ambulatory, like air ambulance transportation, whether emergency or non-emergency, it impacted as well. And then out-of-network services delivered at or ordered from an in-network facility. So there's a lot of different regulations around there, but it's really not limited to any specific type of specialty per se.
Got it. That's good to know. Let's talk about what's required in terms of documentation for practices in order to make sure that they're complying with the No Surprises Act.
Yeah, there are a lot of restrictions and a lot of requirements around exactly the documentation that must be provided by practices, but the law basically requires that the provider must provide a patient with an easy way to understand the explanation of the patient's bill and their benefits and understanding exactly what was done. And they also have to provide a way for patients to contact if they have to have someone that they can contact if a patient has concerns about their bill. So it's not just here's your bill and deal with it type of thing. It's like they have to have a way that a patient can proactively reach out to ask if they have any concerns and get a breakdown and walk through what their bill pertains. Also, which is really important for anyone, for any provider practice or for any hospital system, patient consent forms are required and they must be signed and to help waive the billing protections. So this is important, just like any check-in, this should be part of any patient access workflow, is making sure when a patient arrives that that patient consent form is signed prior to the procedure or service being done.
Can technology help? Are there ways that technology can help make sure that providers are complying?
Absolutely, especially for patient pay estimations. Automation is key here, because a lot of it obviously removes all the manual repetitive data entry processes. It can access same information as any human can, and you can actually probably get better outcomes from using technology in real time and then having like greater accuracy. So obviously there's a lot of less manual data entry errors, or even just trying to do the calculations manually. There's a lot of room for error. So by using technology-enabled services, it helps you provide better care. It improves the processes. The way that technology can help, I mean, basically, if you get to all of your provider fee schedules, you upload those, if you upload those into a software system, it'll manually create the estimates. And that's what you need. And then it also can provide you with a printout of the estimations along with all of their eligibility and benefits information, providing it with like a handout that you can give your patient at the time of service or even at the time of scheduling, so they know what to expect when they come in. It's important, you know, obviously you don't want to have any errors in this. So by automating it, obviously reduces the it reduces the impact of inaccurate estimates that are given to your patients.
Great. I think it's important to keep it in mind as we're having this discussion that, yeah, we want to make sure we're complying with the No Surprises Act, but ultimately this benefits patients too, right? It impacts patients.
Absolutely. Oh, of course. I mean, I am sure all of us have been to a doctor's office and, you know, we want to know what we have to pay up front, you know, especially if these people who are uninsured, self-pays, you know, they are impacted the most, and they want to know what's owed before they come in, especially if it's an elective procedure, whether or not they want to do this. And I always use this kind of analogy. It's like when you're buying an airline ticket and then you show up, and now, you know, before they'd be like, oh, now it's $100 to check in your bag. And these people are thinking, what the heck? I just paid like $600 for my airline ticket, and now you're going to charge me another $100 just to check in my bag because it's over the weight limit. You know, no one wants those surprises. It's like you think you have everything paid in full, and then you get there, and or after it's there, and they're like, oh, send you a bill, and it causes a lot of frustrated patients.
It's a really good analogy. In your opinion, so to piggyback off of that, what is best practice for ensuring that patients understand their financial responsibility? What should providers be doing there?
Yeah, exactly. I mean, I think it's the entire patient access workflow. It's not necessarily just the patient pay estimations. I mean, it starts from the very beginning when you're checking eligibility. You're making sure the prior authorizations are complete and approved prior to the procedure being done. Giving patients additional information, making sure that they have their patient estimates, that they are aware of what they're expected to sign or expected to pay prior to coming in. I've seen in many cases with many of my clients that just by collecting those patient estimates that we're able to provide, it's increased their revenue. It's helped reduce the amount of no-shows, because basically it's like you're already kind of getting that down payment. You know they're going to show up for the procedure. There won't be a no-show. So it also helps kind of at least give you a better accuracy of understanding of whether or not they're actually going to show up for their procedure, because the last thing you want is a no-show. By having, you know, a great workflow in terms of making sure your entire patient access workflow is covered from start to end, it creates efficiencies across your entire organization. I mean, it's not just the patient payments alone. That obviously protects your patients and for yourself as well, because a lot of the stuff that doesn't get paid, it goes into bad debt. So, or in write-offs, and that's the last thing any healthcare physician or provider wants to deal with.
What types of solutions are you seeing on the market that are available to help solve this issue for providers?
Oh, there's a lot of different solutions. I mean, you could just use some vendors just for patient payments or estimates, but there are a lot of front-end patient access revenue cycle management solutions that can actually support your entire front end process. So, one, it's data integrity and making sure that your claims are submitted, clean claims are submitted, that allow you to collect more point of service cash collections, that enable you to reduce the bad debts and write-offs. So basically automating your entire front end, well, I should say that having the ability to automate your entire front end access or patient access workflow, it helps streamline every step of the way. I mean, a lot of this stuff can be automated. Checking eligibility, you don't have to check the portals for those. A lot of that can be automated. You don't have to call for the prior authorizations or the follow-ups. I mean, a lot of this stuff can be automated by checking the portals, and using automation. I mean, it not only decreases a lot of the manual work that your office has to do, but it's more accurate. There's less denials, less room for errors for your office. I mean, basically, the goal is to reduce your costs, reduce manpower, put your people that are calling manually, putting in all your patient pay estimations and calculate them, put them on stuff that is more valuable, like for patient care, anything else that can help improve those patient satisfaction scores, and then ultimately increase your revenue.
So what advice do you have? You went over the solutions. What advice do you have for practices that are starting to explore a patient payment estimation solution?
Honestly, just from from clients that I work with, making sure that you provide bills that are very transparent and upfront, making sure that they understand exactly what they're going to be charged for upfront versus at the end of after the procedure, and then they get the bill and they're like, what is all this stuff? So being transparent is super critical. Providing those easy to read, easy to understand bills are super important as well. Using an automated software to provide those patient pay estimations is definitely more accurate, and it's quicker to get that data versus doing it manually. And then again, having those room for errors. I definitely think software should be used. I do not recommend doing these manually. I see a lot of clients trying to do these manually, and it's so time consuming. I mean, they have 1 to 5 people just doing estimates alone that could be basically automated and streamlined just by using a software. Yeah, I mean, it takes up a ton of time.
Right.
So, and like I said, I mean, the whole process is we take your provider fee schedules, whatever those fee schedules are with your payers, take that into your software. It does all the analytics on the background, and it spits out all the data, and it's on like a PDF form. A patient can sign. You can have a little disclaimer and saying this is basically an estimate, but it's pretty accurate.
I want to give everybody an opportunity to ask some questions while we're waiting on that. Any call to action you would give folks today? Any marching orders?
No, I don't have any marching orders. I definitely think if there's anything that you want to implement, I mean, just from being a customer success person over here, I mean, it's really important. I mean, patient access is so important these days, and being able to provide better care, having open communication, being, over communicating versus under communicating is super critical. The last thing anyone wants is a patient complaint. I mean, that could just roll downstream very quickly, and you lose revenue, you lose the word of mouth recommendations. So the better care up front definitely helps everything on the back end as well.
Great. So we've got a question here. Where have you seen success in implementing patient payment estimation solutions?
A great question. I actually have a client, a pretty large hospital system, that we've implemented the patient pay estimations. And what it has done is immediately it helped increase their point of service collections, so the time of service collections. We're able to get the eligibility information, the prior authorizations, and the patient pay estimations all within one case. So basically we obtain all the data for them. Usually it's a pretty quick turnaround. And then when they call to schedule the patient, they're able to collect those patient estimates. They have 3 different touch points. So time of scheduling at pre-reg, letting them know, okay, again, when you come in, we'll need to collect this payment. And if they can't by chance, then, they can set up payment plans. It just gives them many different touch points of trying to get that revenue up front versus, again, after the fact, when it's less likely that you might collect on some of those fees.
All right, we've got another question here. What about the good faith estimate that is required in SBE Part 2? And how does that tie into requirements, specifically in the skilled nursing facility, since there's no direction from
So, exactly. This comes up a lot, especially in a lot of the clients that I see too. There's a lot of questions around this, and we see the same thing. We don't have any real clear direction on these good faith estimates. I don't actually know the requirements offhand, but I do know that a lot of my clients are implementing this estimation because it is new. It's going to change. It'll continuously change year after year as Congress will continue to make changes on it. However, providing this extra step within your process will cover you most likely. I mean, majority of the time, just by providing the estimates is all that you need to do. I mean, there's going to be several different amendments to this, and I don't know what's yet to come. I just know currently what we're working with, but it's a great question. And if, I find out more information on this, I can follow up with you afterwards.
Yeah, absolutely. Absolutely. Good question. All right. Thanks so much, Laura. This was really, really good information. Yeah. If anybody has questions that come up after, don't hesitate to reach out. We're always happy to help. So, all right. Have a great evening.
Thank you, Bryce, for joining. Thank you so much.